Bismillahirrahmanirrahim. Today I am going to discuss the cardiac cycle. The cardiac cycle events that occur from the beginning of one heartbeat to the beginning of the next heartbeat are called the cardiac cycle. Here, from the beginning of one heartbeat to the beginning of our next heartbeat, the event which occur between these two beats is called the cardiac cycle. So in cardiac cycle, the first event is that spontaneous generation of action potential in the pacemaker. Action potential discharge, electrical discharge occur. This is the first event in the cardiac cycle. The second event is spread of current over atria and contraction. Then this current which is generated in the S anode, it's spread on the both atria and contracted. And due to this spread of current and contraction in ECG, the P wave appear. This is called P wave appearance. The next stage is dilation of ventricles and opening of AV valves, blood flow into the ventricle. When contraction of the atria occur, the AV valve opens and the blood flow from the atria into the ventricles. Spread of current over ventricle and appearance of QR as complex on the ECG. Then this current which originate in the S anode spread to the ventricle and cause contraction of the ventricle and appearance of the QR as complex on the ECG graphs. Contraction of the ventricle, closure of the valves and first heart sound, production of first heart sound. Then when the current spread on the ventricles, it causes contraction of the ventricle, and due to this contraction, pressure is built in the ventricle, it causes closure of the atrioventricular valve, and due to this closure, the first heart sound is produced. Then there is ventricular dilation, closure of the aortic and pulmonary valve. When full contraction of the ventricle occur, then dilation of the ventricle occur, and due to this dilation, the pressure in the ventricle reduce way appear on the ECG. When the ventricle is relaxing, this is the repolarization stage of the ventricle, and in this stage the T wave appear on the ECG graph. And when the pressure in the ventricle reduce, the pressure in the aorta increase, and it cause closure of the aortic and pulmonary valves, and it produce the second heart sound. So these are the events which occur from the spontaneous depolarization of the S anode and to the second heart sound. These are the events which occur during the cardiac cycle, and this one event from spontaneous depolarization of the S anode to the production of second heart sound is called the cardiac cycle. Now each cardiac cycle is initiated by spontaneous generation of an action potential in the sinus node. This is the sinus node, SA node, and here by spontaneous generation of action potential in these node, it causes the cardiac cycle. Diastole and systole. The cardiac cycle consists of a period of relaxation called diastole, during which the heart fill with blood. During relaxation or diastole, the heart fill with the blood, followed by a period of contraction called systole. The contraction phase of the heart is called, or the chambers is called, systole. Ventricular diastole is the period during which the two ventricles are relaxing from the contraction, then dilation and filling. Here you can see these ventricles are relaxing. The valves of the atrioventricular valves open due to reduced pressure in the ventricle, and blood rush from the left atria and right atria to the right ventricle and left ventricle, and in this period filling of the ventricle occur. Atrial diastole is the period during which the two atria, likewise ventricles, are relaxing under suction, dilation and filling. This is the phase in which the atrial dilation occur, and there is filling of blood from the pulmonary artery and pulmonary vein and the inferior and superior vena cava. So during this period both the atria are refilled with the blood. Here you can see this in slow motion, the whole events which occur during the cardiac cycle. So let's play it in slow motion. Here you can see that this is the SA node, and when depolarization of the SA node occur, it causes, due to depolarization of the SA node, the current spread over the both atria, and due to this spread of current, here T wave appear. This is the spread of current you can see here in this graph, and appearance of the T wave in the ECG graph, and it also causes, the spread of current cause contraction of the both atria. Now this current is then passed to the AV node. From SA node, the current is passed to the AV node. Here 1 second delay occur, during which the ventricle relax or dilation of the ventricle occur, and due to reduced pressure in the ventricle, the mitral valve and the tricuspid valves open and allow flow of blood from the atria into the ventricle. Then this current spread over the ventricle, and this causes production of QRS complex. This is the QRS complex is produced due to the contraction of ventricles and spread of current on the ventricle. Here you can see that, and during this contraction, here you can see that the open and the blood then flow into the aorta and the pulmonary vein. Then there is relaxation of the ventricle, and this relaxation of the ventricle is produce the T wave in the ECG. Here you can see that T wave is produced, and this is repolarization, this period from SQ Q, R, S, S and T. This is the S and this is the T segment. During this period, the the ventricles repolarize and dilation of the ventricle occur, and then blood from the atria to the ventricle or rushing of the blood from atria to the ventricle occur and refilling of the ventricle occur. So this whole cycle is called cardiac cycle, in which there is spontaneous depolarization, contraction, spread up current, appearance of the